Obesity profoundly alters the hormonal landscape of the human body, and in women, these disruptions can be particularly dangerous, fueling a silent but deadly rise in hormone-driven cancers such as postmenopausal breast, ovarian, and endometrial cancer. While much attention is given to the role of weight in diabetes and cardiovascular disease, the hormonal chaos set in motion by excess fat is often overlooked in cancer prevention conversations. Yet for millions of women worldwide, especially after menopause, this hormonal imbalance represents a serious carcinogenic force, one that is both preventable and tragically underaddressed in clinical care. At the heart of this issue lies estrogen, a key driver of cell growth in various reproductive tissues. In premenopausal women, estrogen is primarily produced by the ovaries and regulated through cyclical hormonal feedback. But after menopause, ovarian estrogen production declines dramatically. In lean women, this drop leads to a corresponding decrease in estrogen-dependent cell proliferation, a natural shift that helps reduce cancer risk with age. However, in women with obesity, this protective decline is often negated. Fat tissue, especially visceral fat, becomes the body's primary site of estrogen production through the activity of the enzyme aromatase, which converts androgens into estrogens. The more adipose tissue present, the more estrogen is generated, creating a persistent, unregulated source of hormone exposure long after the ovaries go quiet. This excess estrogen stimulates the growth of hormone-sensitive cells in the breast, endometrium, uterine lining, and ovaries. In the absence of regular menstrual cycling and hormonal modulation, these tissues become increasingly vulnerable to DNA damage, unopposed proliferation, and malignant transformation. This is why postmenopausal obesity is not just a background risk factor, but an active promoter of tumor formation in some of the most common and deadly cancers affecting women. Endometrial cancer offers one of the most striking examples. Obesity increases the risk of endometrial cancer by more than fourfold, making it one of the strongest known links between body weight and cancer. Up to 60% of all endometrial cancers in developed countries are now believed to be attributable to excess weight. This is due in large part to continuous, unopposed estrogen signaling in the absence of protective progesterone, which is no longer produced in postmenopausal women. Without progesterone to balance the growth-promoting effects of estrogen on the uterine lining, hyperplasia and cancerous changes can develop unchecked. Breast cancer follows a similar pattern, particularly in estrogen receptor-positive (ER+) subtypes. Postmenopausal women with obesity have up to a 30% higher risk of developing ER+ breast cancer than their lean counterparts. These tumors often arise in an inflammatory and estrogen-rich environment, conditions that promote not only tumor initiation but also more aggressive progression. Moreover, adipose tissue contributes to local estrogen production in the breast itself, creating a microenvironment that directly stimulates tumor growth even before systemic estrogen levels are elevated. Ovarian cancer, while less common than breast or endometrial cancer, is also affected by obesity-linked hormonal changes. Adiposity increases circulating estrogen and insulin levels, both of which can support ovarian tumorigenesis and reduce immune surveillance. Additionally, adipocytes in the tumor microenvironment may promote the spread and metabolic survival of ovarian cancer cells, contributing to late-stage diagnoses and poorer survival. Complicating matters further, the hormonal imbalances of obesity often interact with insulin resistance and chronic low-grade inflammation. Hyperinsulinemia and elevated levels of insulin-like growth factor 1, IGF-1, potentiate estrogen's mitogenic effects, further accelerating cell proliferation and tumor progression. At the same time, inflammatory cytokines such as IL-6 and TNF-alpha, secreted by dysfunctional fat tissue, exacerbate DNA damage, disrupt apoptosis, and fuel the transition from precancerous lesions to invasive malignancies. The result is a biological trifecta: excess estrogen, chronic inflammation, and metabolic dysfunction, each reinforcing the other to drive cancer development. Yet despite this clear and well-documented connection, hormone-related cancers are still not widely discussed in obesity prevention programs. Women are rarely warned that weight gain after menopause can reignite hormonal signaling that puts them at higher cancer risk. Public messaging often focuses on cardiovascular disease or diabetes, leaving a critical gap in awareness and early action. Even in clinical settings, endocrine disruptive effects of obesity are often underassessed. Obesity is rarely treated as a hormonal condition, despite the fact that it causes sustained endocrine dysregulation. Few cancer screening guidelines consider weight or fat distribution when determining frequency or starting age for exams like mammography or transvaginal ultrasound. Most hormone-related cancer risk models still rely on age and family history, failing to account for the significant modifying role of body composition and hormonal metabolism. To reverse this trend, cancer prevention efforts must integrate obesity screening into hormone-sensitive cancer risk assessments, especially for postmenopausal women. Physicians should educate patients about the estrogenic activity of fat tissue and the heightened risks of remaining overweight in later life. Interventions that reduce visceral adiposity and lower systemic estrogen levels, such as weight loss, dietary modification, physical activity, and, where appropriate, hormonal therapy, can serve as both prevention and adjunct treatment strategies. Ultimately, the idea that fat tissue is just inert storage must be abandoned. In the postmenopausal female body, fat becomes a hormonally active organ capable of fueling cancer. Failing to address this reality means ignoring a major modifiable driver of women's cancer risk. And while the link between obesity and metabolic disease has become part of the public lexicon, the hormonal disruptions that underlie cancer development remain far too quiet in our discourse. If we are to stem the rising tide of hormone-related cancers in aging populations, we must begin by seeing obesity not just as excess weight, but as an endocrine condition with serious oncologic consequences.